need hip replacement, you might be a good candidate for what's called a dual mobility implant, and that's tonight's Woman's Doctor. Mercy Medical Center Dr. Marc Hungerford says the implant is designed to help stabilize the hip and provide additional mobility. He showed us a traditional hip replacement.
This is the side of the pelvis. This is the socket with a polyethylene liner. And this is the femur with a stem that goes inside and a ceramic head ball. And the hip articulates like this. So when you're walking, it kind of does that.
And with the dual mobility replacement,
it has a big ball, and then inside it has a smaller ball. So both of these can move. So this would then move inside the socket like that. So it provides an extra mobile component.
and it is extra resistant to the hip popping out of the socket, but it isn't meant for everyone. A good candidate might be a younger person with hip dysplasia. It could be someone who has hypermobility of the joint, or an older person who has had multiple hip revisions, or someone who has a fused spine. Dr. Hungerford says if you're considering hip replacement, talk with your doctor to find out what the best options are for you.